Hello everyone, I am Lucy Cuevas Lucena, and today we are going to discuss you about the menstrual cycle. Let's define first the menstrual cycle. So menstrual cycle is the monthly hormonal cycle a female body goes through to prepare for pregnancy. Your menstrual cycle is counted from the first day of your period up to the first day of your next period. When a female reaches puberty, she usually has a menstrual period every month. The start of period is known as menarche. So, menarche symbolizes the onset of sexual maturity and it's characterized by the onset of the first menstrual bleeding. So next is the normal menstrual cycle. So the mean duration of MC or menstrual cycle, mean is 28 days, range is 21 to 35, and the average of durations of menses is 3 to 8 days. The normal submitted blood loss approximately 30 ml, and evolutions occurs usually day 14, 36 hours after the onset of mid-cycle of LH surge. In this slide, we are going to tackle about the phases of menstruation. So first is menstrual phase, second is follicular phase, third is ovulation, fourth is the luteal phase. So the first phase is menstrual phase. It lasts for about 3 to 5 days. If the ovum is not fertilized, corpus luteum reprogress from the 34th day of the cycle. It results in shrinkage of endometrium, cooling in span of arteries, leading to focal necrosis of the endometrium. The necrosis endometrium is shed along with blood and other secretions. Menstruation is the elimination of the thickened lining of the uterus or endometrium from the body through the vagina. The menstrual fluid contains blood cells from the lining of the uterus or endometrial cells and mucus, and the average length of a period is between 3 days and 1 week. What happened during your menstruation or our menstruation for the girls? So when you menstruate, your body discards the monthly build-up of the lining of your uterus or womb. Menstrual blood and tissues flow from your uterus through the small opening in your cervix and pass out of your body through your vagina. So the next is the first half of your menstrual cycle. It is called the follicular phase. So follicles are the sacs in your ovary that contains eggs. During this part of your cycle, the follicles selected for that particular month begin to grow. Proliferative phase starts off the end of menstrual phase. Its duration is about 10 days. At the beginning of this phase, most of the endometrium has been disseminated. Later, endometrium starts healing and then proliferate rapidly from 5th to 14th day of menstrual cycle. This proliferation occurs under the influence of estrogen. There is growth of simple tubular glands and blood vessels, and endometrium increased in thickness to about 3 to 5 mm, and the endometrial glands produce the thick mucus. At the end of proliferate phase, ovulations occurs. What will happen during the follicular period? We have here a 3 phase for follicular. First is early phase. At the beginning of your cycle, estrogen and progesterone levels are low. A part of your brain called the pituitary gland produces 2 hormones, follicle-stimulating hormones or FSH and luteinizing hormone or LSH. FSH stimulates the growth of egg and the follicles. These follicles then begin to produce estrogen in the form of estradiol. Other hormones such as inhibin A and inhibin B are also produced at this time. Second is the mid-phase. Several follicles will grow to the atrial stage, which means there is a fluid-filled cavity in the follicles next to the egg. The granulosa cells surrounding the follicles multiply, leading to increased estradiol production. This increase in estrogen acts as a negative feedback on the pituitary gland. So, this leads to decreasing levels of both FSH and LH. The last one is the late phase. In this phase, a dominant follicles emerge which continues to produce rising levels of estradiol. And in inhibin A, FSH causes an increasing in the number receptors of LH in the ovary, which in turn lead the ovaries to make growth factors. The follicles produce these growth factors in preparation for ovulation, the release of the egg, and potential implantation of a fertilized embryo. During the follicular phase, the developing follicles cause a rise in the level of estrogen. The hypothalamus and the brain recognize these rising levels, and the brain releases a chemical called gonadotropin releasing hormones, or GnRH. These hormones prompts the pituitary glands to produce rise levels of luteinizing hormones, or LH and SH. Within 2 days, ovulation is triggered by the high level of LH. The egg is funneled into the fallopian tube and towards the uterus by way of small hair-like projections. The lifespan of the typical egg is only around 24 hours unless it meets a sperm during this time, so it will die. Next is ovulation. Ovulation is the release of a mature egg from the surface of the ovary. This usually occurs mid-cycle around 2 weeks or so before menstruation starts. Now, what happened during the ovulation phase? Ovulations only happen during day 11 and 21 of your cycle. A hormone called luteinizing hormone, or LH, a surge triggered the release of the egg that most ripe. At the same time, your cervical mucus becomes more slippery to help sperm to make their way to the egg. And the last phase is secretory phase, or luteal phase. This phase lasts for about 14 days. It starts after ovulations and extends up to the next menstrual phase. And endometrium thickens up to 6 mm, and the glands become bigger or tortuous and filled with the secretions. Stromal cells proliferate and spiral arteries become more coiled and dilated. This caused due to actions of progesterone and estrogen on uterine endometrium. Next reporter, please.
Good day, everyone. My name is Haina Manggilimutan, and now let's proceed to the number 2 objectives, all about menstrual cycle, which is the hormonal tissue and behavioral changes. Hormones and your menstrual cycle. It all starts with your endocrine glands because they produce the hormones that determine when you get your period, the amount of menstrual flow, and what happens to your reproductive organs. The area of the brain called the hypothalamus connects your nervous system and endocrine system by way of the pituitary gland, which also is in the brain and controls the hormones necessary for reproductive health and your period. The 6 hormones serves as the chemical messengers to your reproductive system. Number 1 is the gonadotropin, which is the releasing hormones GnRH. Number 2 is the follicle stimulating hormone, which is the FSH. Third is the luteinizing hormone, LH. Number 4, estrogen. Number 5, progesterone. And number 6, testosterone. During your menstrual cycle, the hypothalamus first releases GnRH, or the gonadotrophin. This causes a chemical reaction in the pituitary gland and stimulates the production of the follicle-stimulating hormone and the luteinizing hormone. Your ovaries produces estrogen, progesterone, and testosterone. Yes, the male hormone, in reaction to the stimulation by FSH and LH. When these hormones work harmoniously, normal menstrual cycle occur. Hormone levels fluctuate. When you say fluctuate, it is mutate, shift, or change. Behavioral tendencies throughout the menstrual cycle are tied to the variation in hormones that occur throughout the month. During these fluctuations, you might notice a change in mood or even your physical health. The following are the different phases of your cycle and how they can affect your well-being. The first phase is the follicular phase. This is most likely the happy part of your cycle. This phase begins when you start your period and typically lasts for about 2 weeks. During this time, a hormone called estradiol begins to increase. Most women feel energetic and joyful during the follicular phase, especially when comparing it to the luteal phase. The second phase is the ovulatory. During this phase, the luteinizing hormone, which will eventually induce ovulation, begins to rise. Some scientific studies have shown that women have an increase in libido and higher pain tolerance during this phase. Women may also feel more attractive during this time as well. The third and last phase is the luteal. During this phase, there is an increase in the hormone progesterone. Women typically feel moodier and more stressed during this time. This phase occurs just before your period. Effects on other health issues. Besides the general physical, mental, and emotional changes you feel throughout the month, existing health conditions can also be affected by your menstrual cycles, fluctuating hormones. The first and the most common one was depression. PMS can make depression symptoms worse. Additionally, women with a history of depression are more likely to experience PMS or premenstrual dysphoric disorder or PMDD, which is more severe form of PMS. The next one is the anemia. Anemia, it is if you have heavy bleeding during your period. You may develop iron deficiency anemia. Those who are already anemic will may become pale, tired, or weak due to period-related blood loss. How to deal hormonal fluctuations. There are a few ways to combat the unpleasant feelings you have during the luteal phase of your menstrual cycle, many of which center in maintaining a healthy lifestyle. First one, eat a healthy and balanced diet. Get energy from nutritious foods like vegetables, unprocessed proteins, healthy fats, and whole grains. Avoid excess salt to reduce bloating. Exercise regularly. That's the 2 one. Exercising produces endorphins while helping boost your mood and giving you more energy. Third one, avoid alcohol and reduce caffeine intake. Acting as a depressant, alcohol can worsen your mood and impair cognitive function. caffeine also can increase anxiety to try to cut back on it when experiencing PMS. Next one is drink plenty of water. More fluids will help to reduce bloating and keep you hydrated when you're lacking energy. And lastly, get enough sleep. When you're more rested, you'll have fewer problems with fatigue and clumsiness.
Good day everyone, I am Norigin Ortega and my topic is discuss the influence of external factors such as stress, relationship, and environment to the menstrual cycle. Influence of external factors of stress to menstrual cycle. So when under the stress, your body produces cortisol depending on how your body tolerates stress. The cortisol may delay or left period. It's called amenorrhea. According to Dr. Coleconda, if stress continues, you can go without a period for a long time. Stress causes your body to go into the fight or fight mood. It's just the way we burn. When you're in this mood, it affects hormones, which in turn affect your evolution or cause your period. This means you may period that are late or even stop completely for several months. Because stress can affect the part of the brain responsible for producing hormones, it can throw hormonal levels out of whack, which can lead to the changes in the frequency and duration of your menstrual period. Influence of external factors of environment to the menstrual cycle. Many environmental factors may affect characteristics of menstrual cycle, including workplace, caffeine consumption, smoking, occupation, physical activity, diet, age, weight, exposure to organic solvent, medical condition, and lifestyle factors. However, it's perfectly possible that environmental change, such as change in diet or added stress, is causing late period, as hormones are sensitive to the stress and this will change through the menstrual cycle. Relationship between stress and menstrual cycle. Stress has been found to be associated with longer cycle, to be associated with shorter cycle, and to have no association with cycle length.
Good day everyone, my name is Wemar Saganay. For today, I would like to tackle with you the etiologies, evaluation, and treatment of dysmenorrhea. Before I go deeper into my discussion, I would like to introduce to you first what is dysmenorrhea. Dysmenorrhea is a Greek term for painful monthly bleeding. Pain associated with menstruation is called dysmenorrhea. More than half of women who menstruate have some pain for 1 to 2 days each month. Usually the pain is mild, but for some women, the pain is so severe that it keeps them from doing anything or from doing their normal activities for several days a month. There are two types of dysmenorrhea, the primary dysmenorrhea and the secondary dysmenorrhea. Let's talk first the primary dysmenorrhea. Primary dysmenorrhea is a lower abdominal pain happening during the menstrual cycle, which is not associated with other diseases or pathology. Primary dysmenorrhea is the cramping pain that comes before or during a period or menstruation. This pain is caused by natural chemicals called prostaglandins that are made in the lining of the uterus. Prostaglandins cause the muscles and blood vessels of the uterus to contract. And then we have secondary dysmenorrhea. Secondary dysmenorrhea is usually associated with other pathology inside or outside the uterus. Secondary dysmenorrhea is caused by a disorder in the reproductive organs. The pain tends to get worse over time and it often lasts longer than normal menstrual cramps. For example, the pain may begin a few days before a period starts, then the pain may get worse as the period continues and may not go away after it ends. Let's now tackle the etiologies of dysmenorrhea. Primary dysmenorrhea is thought to be caused by excessive levels of prostaglandins, hormones that make the uterus contract during menstruation. During the menstrual period, the uterus contracts to help expel its lining. Hormone-like substances or prostaglandins involved in pain and inflammation trigger the uterine muscle contractions. Higher levels of prostaglandins are associated with more severe menstrual cramps. Secondary dysmenorrhea is typically caused by a gynecologic disorder such as endometriosis, adenomyosis, fibroids, or benign tumors, pelvic inflammatory disease, or PID. So, this pain tends to escalate over time. Endometriosis. Endometriosis is a condition in which the tissue lining the uterus or the endometrium is found outside the uterus. These pieces of tissue bleed during your period. They can cause swelling, scarring, and pain. Adenomyosis. Adenomyosis is a condition where the lining of the uterus grows into the muscle of the uterus. This condition can cause the uterus to get bigger than it should be, along with abnormal bleeding and pain. Fibroids or benign tumors, growths on the inside, outside, or in the walls of the uterus. Pelvic inflammatory disease or PID. Pelvic inflammatory disease or PID is an infection caused by bacteria that starts in the uterus and can spread to other reproductive organs. PID can cause pain in the stomach or pain during sex. Next, let's tackle the evaluation of dysmenorrhea. Primary dysmenorrhea is diagnosed depending the history and physical examination. Pelvic examination. A pelvic examination is important for evaluating dysmenorrhea if the history of onset and duration of lower abdominal pain suggests secondary dysmenorrhea, or if the dysmenorrhea is not responding to medical treatment. Ultrasound. The use of ultrasound in the evaluation of primary dysmenorrhea has little significance. However, ultrasound can be useful in differentiating secondary dysmenorrhea and causes that include endometriosis and adenomyosis, just like what I have mentioned earlier. And last, let's tackle the treatment of dysmenorrhea. There are two types of treatment of dysmenorrhia. The first one is pharmacological treatment, and the second one is non-pharmacological treatment. Pharmacological treatment are non-steroidal anti-inflammatory drugs or NSAIDs, phenamates or mefenamic acid, ibuprofen, paracetamol, oral contraceptive pills or OCPs, progestin-only pills or POPs. Non-steroidal anti-inflammatory drugs or NSAIDs are considered to be the first line of treatment for dysmenorrhea. NSAIDs are very effective in the treatment of dysmenorrhea. For other women who are using it, it is effective for them. Phenamates or mefenamic acid may have slightly better efficacy for treatment of dysmenorrhea. Phenamates have a dual action of blocking the production of prostaglandins or PGs and inhibiting their actions. One study recommends ibuprofen and phenamates to be preferred in terms of safety and efficacy. Paracetamol is also valid for dysmenorrhea treatment. Oral contraceptive pills or OCPs are reported effective in reducing the dysmenorrhea pain. OCPs have mechanism by limiting endometrial lining growth. It decreases the production of prostaglandins. Progestin-only pills or POPs are suitable more for patients with secondary dysmenorrhea. Secondary dysmenorrhea related to endometriosis, whereas their effectiveness as a treatment for primary dysmenorrhea is not evident. So progestin-only pills are suitable for them. The next treatment is non-pharmacological treatment. Maintaining an active lifestyle and a balanced diet that is rich in vitamins and minerals are generally recommended for better health outcomes. In particular, such diet and lifestyle are useful to reduce the intensity of dysmenorrhea. Different types of exercise are generally recommended due to several health benefits and low or no risk. It also helps reduce the intensity of dysmenorrhea. No clear evidence about certain exercise activity or specific duration, but moderate exercise is recommended.
Let's proceed now to the second part of our report, which discusses the hormonal regulation of the non-pregnant women. First off is the psychological effects of estrogen and progesterone. This will be reported by me with the collaboration of Miss Decena. So, estrogen. Estrogen, mainly called sex hormones, while progesterone, it is mainly called the pregnancy hormones. While estrogens are a group of compounds named for their importance in the estrous cycle of humans and other animals. They are the primary female sex hormones, although they are found in males as well. There are three major naturally occurring forms of estrogen in women. These are the estrone or E1, estradiol E2, and estrol E3. Estatothrol or E4 is produced only during pregnancy. In addition to regulating the menstrual cycle, estrogen affects the reproductive tract, the urinary tract, the heart, and blood vessels, bones, breast, skin, hair, mucous membranes, pelvic muscles, and the brain. Secondary sexual characteristics such as pubic and armpit hair also start to grow when estrogen levels rise. Many organ systems, including the musculoskeletal and cardiovascular systems and the brain, are affected by estrogen. And here is the physiological effects of progesterone: stomach upset, changes in appetite, weight gain, fluid retention and swelling, fatigue, acne, drowsiness or insomnia, allergic and skin rashes, hives, fever, headache, depression, breast discomfort or enlargement, and premenstrual syndrome or PMS.
Hello everyone, my name is Wemar Saganay. At this time, Nori and I will tackle with you the process of hormonal regulation in females. There are four major hormones involved in the menstrual cycle: follicle-stimulating hormone, luteinizing hormone, estrogen, and progesterone. The first part of the process of regulation in females is hypothalamus. The hypothalamus is a part of the brain that has a vital role in controlling many bodily functions, including the release of hormones from the pituitary gland. Gonadotropin-releasing hormone is a releasing hormone responsible for the release of follicle-stimulating hormone and luteinizing hormone from the anterior pituitary. GnRH is a tropic peptide hormone synthesized and released from GnRH neurons within the hypothalamus. Pituitary gland. Pituitary gland is the major endocrine gland, a pea-sized body attached to the base of the brain. The pituitary is important in controlling growth and development and the functioning of the other endocrine glands. Follicle-stimulating hormone. Follicle-stimulating hormone is a hormone secreted by the anterior pituitary gland which promotes the formation of ova or sperm. Luteinizing hormone. Luteinizing hormone is a hormone secreted by the anterior pituitary gland that stimulates ovulation in females and the synthesis of androgen in males. Ovaries. Ovaries are a female reproductive organs in which ova or eggs are produced. Ova. Ova is a mature female reproductive cell which can divide to give rise to an embryo, usually only after fertilization by a male cell. Estrogen. Estrogen is any of a group of steroid hormones which promote the development and maintenance of female characteristics of the body. Such hormones are also produced artificially for use in oral contraceptives or to treat menopausal and menstrual disorders. Progesterone. Progesterone is a steroid hormone released by the corpus luteum that stimulates the uterus to prepare for pregnancy. And that's it. Next is Nori will going to explain to you the chart of the process of hormonal in females.
Gonadotropin releasing hormone or GnRH is produced by the part of the brain called the hypothalamus. When it circulates in the blood, it causes the release of two important hormones from the pituitary gland into another specialist part of the brain.
Follicle stimulating hormone or FSH is produced by the pituitary gland during the first half of the menstrual cycle. It stimulates development of the maturing ovarian follicle and control ovum production in the female and sperm production in the male. Luteinizing hormone or LH is also produced by the pituitary gland in the brain. It stimulates the ovaries to produce estrogen and progesterone. It triggers ovulation or the release of mature ovum from the ovary, and it promotes the development of the corpus luteum. Progesterone is produced by the corpus luteum in the ovary. Its function is to prepare the endometrium or the lining of the uterus for the reception and development of the fertilized ovum. It also prepares the production of estrogen after ovulation has occurred.